So, folks, this is an interview with a couple of patients of mine. I'm Dr. Craig Bax. I'm the Chief Medical Officer, founder of the Cure Center for Chronic Disease, where for the last 10 years we've been reversing arterial disease and type 2 diabetes. And I'm happy to say have not had any of our patients suffer a stroke or a heart attack in that 10 years. So, but one of the things that we do very commonly is work with families, couples, because a lot of our programs lifestyle related. And I'd like to welcome and thank Rich and Nesa Brower for taking the time to chat with us today and maybe share some of their experience to help others understand how this can be helpful to them, particularly as couples. So Rich and Nesa, thank you and welcome.
Thank you for being our doctor.
Well, it's my pleasure. It's been a while. We've been at it for a few years, and it's been a real pleasure. I just wondered, maybe start out by just getting your comments about your experience with the Cure Center program for reversing arterial disease, and what would you tell somebody if you met them on the street or at the grocery store, and to help them understand what it's been to you guys?
Well, for me, about 19 years ago, going on 20, I woke up one morning with extreme pressure, nausea, and fortunately, within a little over half an hour, my wife drove from Petersburg to the hospital in Springfield. And so I had complete blockage on my widowmaker. Fortunately, everything turned out okay. And so when my primary care doctor retired, then I was looking for somebody that specialized in heart health. And so that's when we had the opportunity to sit down and talk and look at what you're doing with the heart, with the ability to look at soft deposits instead of cardiologists that wait until they're hard deposit. And so I've had no reoccurrence of any heart issues for like the almost last 20 years. So that was very important to me.
And Nesa didn't become a widow.
Yes. No. She was close. Yeah, my cardiac nurse said I had between half an hour and an hour to be there when I did. And so I was very fortunate.
Yeah, it's. I think what you bring up is that, how did you feel, 10 minutes before? Well, you said you woke up with these symptoms, but when you went to bed the night before, did you have any sense of any warning that anything bad was going on?
Nothing at all. I mean, just absolutely zero. I mean, I had somebody see me at work walking fast and wondered why I was always in such a hurry. So all of a sudden it hit me, and that was the first symptom I had.
Yeah. Well, so you went with the rescue plan that time. Unfortunately, the rescue plan worked for you. Our goal is to have a more proactive cure plan in place so that the rescue plan never has to be activated. And I think you're part of living proof. Of course, it's always difficult to prove that something didn't happen because of something that we did. That's why prevention is so difficult. But that's why I think it's important, to share that, we have had a cumulative experience, over 1,000 patients who have had the same experience that you've had over the last 10 years that I've been doing this, as I've learned about how much more possible it is to reverse arterial disease. So, and then Nesa got involved in this as well, sort of came along for the ride.
Yes, I did. It's been a good ride too. I have the potential genes of a stroke, so I appreciate this process to just stay on top of my health. I love the fact that I see you twice a year. It's not because I'm ill, it's because we're watching. And I just love the fact that you're looking for things rather than waiting until they happen, which they did with him. So that's my best part about this.
Well, the big advantage with working with you is we never see a PA. So when we have an appointment, we go in, there's literally no one else in the office. We go in, we meet with you, we have all the time we want, and it's with you. It's not somebody else that's not as well trained as you are.
Absolutely.
Well, I appreciate that. Although if looks count, I'm sure that that's probably a disadvantage. But nevertheless, the experience, and that after 10 years, you might think you've seen it all, but I'm always learning new things, and I think that's very helpful as I encounter new and different patients and problems all the time. I'm curious about one of the things that we do that's unique is we follow the disease with the carotid ultrasound every now when things are stable every year, but in the beginning maybe every 6 months. How does that affect your care in your mind?
Well, a lot of what you teach is nutrition. So the fact that we cut out sugar, we cut out on carbohydrates, and then we see that reinforced with that ultrasound is very reassuring. I mean, if you've ever had an event like that, that's something that's always in the back of your mind, something that you're always thinking about, and to have that reassurance that you're doing the right thing is very positive.
Yeah, I'm not going to pull up your results, but I think one of the things that we shoot for with our patients is to see their arteries get younger, and by that we mean less inflamed, and compared to others the same age and gender, that they actually get better. And I think that level of accountability and measurement certainly helps me know if I'm doing the right things, in terms of recommendations, and also whether you all are doing everything you can do, and that fluctuates. We know that lifestyle adherence is tough, but one of the things I would say, working with couples, is that I see, individually they're more successful if they're doing it together, because if one is on board with a healthy, low carbohydrate diet, and the other isn't, it can be easily sabotaged and hard to maintain. What are there any things that you find particularly challenging? I hope it's a short list for our audience, but
well, I love to bake, so there's nothing that I bake that's really good for you. So I have elderly neighbors, so I do a lot of baking for them instead of for me. But let me add another thing that's very important to us dealing with you, and that's the fact that we can have instant contact. My wife has had shingles 4 or 5 times, and there was one time she was in St. Louis. She had an occurrence happen on a Sunday morning in St. Louis, and she was able to call your cell phone, talk with you. You said, come to the office as soon as you can get here and take this medicine, and it will lessen the results of shingles. And instead of a 4 or 5 week issue, it was just a day or 2. And so that's very important that we have that sort of ability, because how many times have I called a doctor's office and ended up leaving a message with the nurse and never talking to a doctor? And that to me is the most important thing, is this interpersonal communications that we're able to establish to find out what's our trouble and then get answers almost immediately.
well, I think with most everything, we recognize that early recognition and early intervention, whatever the problem is going to lead to generally a better result. And so, yeah, it really makes it a lot easier for me to get the message, straight from the source, and not have it go through interpretation with multiple layers of staff, and the story changes. And so just dealing with it as quickly and immediately as possible, I think is it's been a benefit to me as well. And that's why I developed the application, like we call it the CureCoach.app, to make that messaging not only more convenient, but also it needs to be secure and private, because it is private health information. And most of the things that we deal with aren't that embarrassing, but there's really nothing. It keeps your information safe and secure. So I'm curious. So what would you say to someone who's hesitant to have these tests to see if they have underlying arterial disease or insulin resistance, who takes the attitude, well, better off not knowing, or just are putting these things off, thinking that you know they'll get to it someday. There's no sense of urgency about it. What would you say to anybody who's hesitant about participating in this type of program?
Well, if they believe ignorance is bliss, then you're not the right person to have as a doctor. That my philosophy is, especially with the heart, a lot of the issues that you have can be fixed, repaired, and if you wait, then you're just asking for permanent damage and even death. So it's important that you're proactive. And my wife she's an instructor in years gone by for a CPR, and so she understands that a lot better than most people.
Well, I'm going to add that I would say throw those hesitations away and jump right in, because I used to feel that way. If I don't know, I won't worry about it. But this process, especially not only the arterial scan, but also the body scan, just keeps me, I was a PE teacher, health teacher. This process just gets to me, okay, I've got 6 months to get that body scan, get rid of some of those levels that I had built over the years. And I feel like now I'm in the best shape I've ever been for a long time, certainly before children. But my weight is where I want it to be. It's a constant reminder to me that prevention is the key. So I just enjoy the whole thing, and I see no reason to have any hesitation about jumping into this program.
Well, and your focus is on prevention, not treatment. And that's what I like. I just soon not have to deal with it and be treated if we can be proactive. And there's a lot of diseases, chronic diseases, that are caused by lifestyle.
Yeah. Well, there is a little bit of a difficulty with the semantics, because in essence, we're preventing an event like you suffered, was it 19 years ago, a heart attack, by intervening earlier than, there is an underlying disease process. It's a atherosclerosis, I call it, silent but deadly threat, that unless you look, you won't know. But once you see it, it's very compelling to get rid of the associated risk of the event, which is unpredictable in terms of when it's going to happen. But what is not known to many people, including a lot of physicians, sadly, is that this is a disease that's extremely common. We should all assume that we have it probably past the age of 35, and that it's far more reversible than most doctors would have you believe. And it's mostly because they just haven't been incentivized or, taken the time to learn, the tricks of the trade, if you will, of how, through the optimal lifestyle, supplements, and judicious use of pharmaceuticals, that we can see reversal of arterial inflammation and age, and I have a longer, more optimal life. So, well, I do appreciate both of you coming on for this recording, and thank you. And part of my incentive is that the longer I keep you guys alive, the longer I get to enjoy working with you. So I hope you feel the same way.
We do. Thank you.
We do. Thank you for being there for us.
All right. You're more than welcome. My pleasure.